I'm going to be reading from page 26 to 27. Overview of medication administration. Preparing to administer medications. Often the words drug and medication are used interchangeably. A drug is a chemical substance that alters the function of a client and may be helpful or harmful depending on the drug. For example, drug abusers use drugs for other than positive health outcomes. Medications are more commonly is used when talking about drugs that are used for therapeutic or helpful effects. In this course, the word medication will be used when talking about drugs or medications used to treat clients. Administering medications is an important responsibility and must be taken with great care. It is never an easy task and thus cannot be undertaken when you are trying to do several things at once. In order to prevent errors and possible harm to a client taking the medications, you must focus on the task solely. Do not talk to others while you or they are preparing and giving medication. Do not stop this task unless there is an emergency. Stop and starting can cause medication errors. Give medication to one client at a time. Focus on giving all the medications for one client before moving on to another client. This will help prevent getting one client's medication mixed up with another client's medication. Before taking the medications to the client's room, mark your place in the MAR. Remember to pour a cup, which is 8 ounces, of water for the client to drink with their medications. Giving the client a sip of water beforehand may make it easier to swallow the medications. Some clients take multiple pills at once. Ask them how they like to take their pills, one at a time or several at a time. If they prefer only a few at a time, assist them to take 1 to 2 pills at a time. When all medications have been swallowed, encourage the client to drink another cup of water to make sure all the medications were swallowed and moved into the stomach. Encouraging the client to drink water also helps them stay hydrated. Oftentimes, clients do not drink enough water, and encouraging drinking of water at the time of medication administration will assist them in getting the amount of water that they need each day. It may be helpful to give medications to clients who do not need assistance first, leaving those needing assistance last. This allows you to take the time you need to help those who need extra assistance taking their medications. Your agency may have other recommendations and tips for giving these medications to their clients. Before you begin administering medications, check for any specific information needed prior to giving certain medications, such as pulse, blood pressure, or blood sugar readings. This information is needed prior to giving certain medications to some clients. It is important that this information be gathered as close to the time the medication is to be given as possible. Your agency will have a system to provide this data to you in time for you to administer medications. Whether you are to give the medication or hold the medication will be clearly stated for each client based on the assessment data provided. For example, an example of an assessment data that you would need before giving a medication if the MAR stated the client is not to get their digoxin, which is a heart medication, if their pulse or heart rate is 60 or below. The agency designated person will assess the client's pulse and tell you the pulse rate. For instance, if the pulse was reported to the medication aide as 68, the medication aide would give the medication as listed on the MAR. If the pulse was 52, the medication aide would hold or not give the medication, and they would need to follow the agency's instructions to report this to their supervisor. You may have special instructions regarding omitting, which means not giving as ordered, a medication. In some agencies, medication aides have additional training that allow them to do these vital signs. These skills are beyond the scope of this course. When administering oral medications, it is helpful to be aware of absorption rate. Absorption rate, meaning oral medications are absorbed or used by the body at different rates depending on various factors, including the content of the client's stomach if the client has any digestive problems. Another factor to consider when administering oral medications is how your client is presently feeling. You should never give oral medications to a client who is vomiting. If your client is vomiting, you should wait to administer oral medication until they are feeling better and are able to keep medications down. If you have to delay giving the medications beyond the time allotted to give the medication, tell your supervisor. Types of medication preparations. Medications come in many different forms. The medications that you will be giving as a medication aid may appear in many different forms. The form will be listed out on the MAR. The table below provides the most of the forms in which medications appear.